Good morning, ladies and gentlemen. Thank you for joining us this Saturday morning, tuning in to our public forum on Skin Cancer 101, organized by the National University Cancer Institute of Singapore, also known as NCIS. My name is Ivy Lim, your MC for today. And for those of you who are joining us for the first time, a very warm welcome to you. If you are a returning participant and you've seen us before, joined us before, give us a 1 at the Q&A box so that we know you're returning and we're seeing old friends again. And warm welcome once again, to all our new joiners, our first timers. This will be the first, and hopefully many more public forum that you will join us. Who is NCIS? What is NCIS about? So NCIS is actually offering a broad spectrum of cancer care and management covering both pediatric and adult cancers, with expertise in prevention, screening, diagnosis, treatment, rehabilitation, palliative care, and seeing is believing. Let us show you a short video what NCIS is all about.
From its humble beginnings as an oncology department within NUH, the National University Cancer Institute, Singapore, has come a long way to becoming a national centre providing world-class cancer care today. As the only cancer institution in Singapore with capabilities to treat both adults and children, our mission is to provide not only incredible care, but to also set new standards in cancer care. We do this with the 3 pillars of NCIS Incredible Care. By providing incredible treatment, supported by an incredible system that's data-driven and patient-focused, and developing the incredible people at NCIS. We have world-class expertise in multiple specialities and subspecialty for every part of the body, from breast to prostate. Our specialists have developed deep expertise in all aspects of cancer care. But more than just treating the disease, NCIS provides holistic end-to-end cancer care, from screening, diagnosis and treatment, to rehabilitation, palliative and long-term care. And we do this from cradle to adulthood through the twilight years. Beyond standard cancer care, NCIS aims to provide cutting-edge treatments so our patients have more and better options. Our specialized programs have seen outstanding results for patients with dismal prognosis. The NCIS CAR-T therapy program is one excellent example, delivering exceptional outcomes for our leukemia and lymphoma patients. CAR-T therapy has drawn us international accolade. In particular, after the successful treatment, 6-year-old British boy Oscar Saxelby Lee in 2020, who has remained cancer-free since. These specialized treatments are the result of our strong clinical trials program, led by award-winning clinician scientists and supported by a regional and international network of research partners. These cutting-edge research innovations provide patients access to the newest cancer treatments, which are often not yet available as standard care. Indeed, our strong emphasis on research has helped NCIS achieve excellent clinical outcomes. Survival rates of NCIS bone marrow transplant patients are comparable to international leading transplant centers in the world. Patients with non-small cell lung cancer also have 3-year survival rates that surpass international benchmarks. NCIS also innovates and uses data to drive our operations and business intelligence. A chemotherapy and cancer treatment calculator developed with IT partner BotMD helps patients estimate their monthly out-of-pocket expenses and improves financial counseling. Our incredible system works towards ensuring patients can access the right treatment at the right time and in the right place. Taking the lead for oncology services under the One NUHS Care Plan, NCIS provides comprehensive and integrated services across 3 hospitals under the NUHS cluster: NUH, Ng Teng Fong General Hospital, and Alexandra Hospital. Our pioneering NCIS On The Go program also brings low-risk procedures to cancer patients living in the West, with our oncology-trained doctors and nurses providing the same quality treatments regardless of location. Beyond NUHS, NCIS also provides radiation therapy services at 2 other hospitals. With these, our patients experience more convenience and seamless care. From the ease of booking their first visit to having their treatments and the collection of medication, we aim to give the best support to our patients as they fight cancer. All these would not be possible without the incredible people who work at NCIS. Over 600 doctors, nurses, allied health professionals, and operations and admin staff, all committed to creating a wow experience at every touchpoint and interaction, because every person matters: patients, caregivers, staff, and stakeholders. We recognize those who go the extra mile in caring for patients and leading their teams, and cheer those scaling greater heights in clinical care and research. As NCIS grows, we are strengthening the NCIS culture as well as our team's capabilities through tailor-made team coaching and professional training. By providing incredible treatment, creating incredible systems, and bringing out the full potential of our incredible people, we deliver incredible care that makes a difference to the lives of our patients and their families. Because at the National University Cancer Institute, Singapore, we set new standards for cancer care.
This is NCIS for you. And before we begin today's session, housekeeping to note, your microphone is muted by default. Please type in your questions in the Q&A box, and our specialists will try very much, as much as possible to answer them live during the Q&A segment. And do note that this webinar will be streamed live on NCIS and 365 Cancer Prevention Society's Facebook page. You may visit the Facebook pages again to watch the webinar or share it with your friends. The slides will also be on the Facebook page, so do look out for it. We would also like to take the opportunity to thank our partners, Singapore Cancer Society, 365 Cancer Prevention Society. A quick question is, do we actually look ourselves in the mirror like closely? I know most women, we do. We try to detect if there's any blemishes or any special marks and things like that. But how many of us actually do look into abnormal growth on our skin, on our nails, and that can potentially be an early warning sign of skin cancer? So in today's program, our specialist would be presenting on how to recognize any abnormal growth, prevention tips, and the various treatment strategies for skin cancer. We also have a patient sharing at the end of the doctor's specialist sharing. So without further ado, we are very, very honored and pleased again to welcome Dr. Mok Jun Ray to give the welcome address. And also he'll be delivering his presentation on how can I prevent skin cancer. And Dr. Mok is actually a consultant of the Division of Dermatology, Department of Medicine with NUH, and also a consultant with NCIS. Over to you, Dr. Mok.
So good morning, everyone. It's my great pleasure to be here today with all my colleagues, Dr. Adeline Yong, Prof. Peter Goon, as well as Dr. Mark Puhendran. And I'd like to thank all the audience today for joining us on this bright and sunny Saturday morning, to have a 2-hour session with us. And over the course of these 2 hours, we'll be touching on different aspects of skin cancer, both in terms of its prevention and its different presentation. And we feel that skin cancer is an increasingly important topic in view of its incidence in the population and how it's able to arise not only on the face, the trunk, but also on the digits, and hence affecting both form and function. And we hope that you'll find this first 2 hours a very informative session. So before we go further, we'd just like to set off a little poll question for the audience to answer. Right, so we have roughly even, but I think most answer is 56%. Well, fairly even, but well, half-half, so to speak. Right, so we hope that after today's presentation, we're able to give and lend further insights into prevention, which is the topic of my presentation today, as well as other knowledge with regards to skin cancer. So to kick things off, I'll be presenting the first lecture on skin cancer prevention. Right, so for skin cancers itself, when we are talking about skin cancers, we are actually referring to cancerous growths that occurs on the skin. That being said, the skin by itself is not a single entity, and it consists of the epidermis, which is the top layer of skin, most exposed to the environment, followed by the dermis, which sits just underlying that. So if we were to imagine the epidermis as a brick wall, the squamous cells are the cells that forms, they are building blocks of this wall. And the basal cells, as the name suggests, forms the base layer of this wall. And lastly, melanocytes, which are cells that produce pigments that gives our skin color. So squamous cell, basal cells, and melanocytes are all able to transform into cancer. So squamous cells would become squamous cell carcinoma, for which they will be, so carcinoma being the medical term for cancer, and basal cell carcinoma as well as melanoma. So in Singapore, collectively, squamous cell carcinoma and basal cell carcinomas occurs for about 70% or 2/3 of all skin cancers, and they are known as non-melanoma skin cancers. So if we were to look at the Singapore Cancer Registry, which is essentially a collation of 5 years data, with the last being published in 2021, what we will find is that non-melanoma skin cancers came in at 6 for males and 7 for females respectively. But if we were to take a closer look, according to age-specific bandings, we'll find that non-melanoma skin cancers do not arise in a young age group from 0 to 29, but from 30-year-old onwards, they start appearing, coming in at 7th for males and 10th for females. And thereafter, they will start their slow ascendancy all the way up the ladder, where in the 80-plus years old age group, they come in 4th for both males and females, just behind colon, breast, lung, and prostate. So in an aging population like Singapore, we'll be expecting to see more skin cancers in the future. When we talk about risk factors for skin cancers, that's usually divided into two: non-modifiable risk factors, meaning these are factors that's out of our control, and these would be such things as family history, being of an older age, having a lighter skin tone, and inheriting certain rare conditions. That being said, there are some factors which are modifiable and within our control, and that, of course, is to minimize exposures to certain chemicals in the environment, minimizing medications that may suppress your immune system, and lastly, smoking. In a meta-analysis, which essentially is an analysis of different studies that have been published, in this case here from 1997 to 2017, what they found was that a current smoking status confers a 1.3 increased risk of developing skin cancers compared to non-smokers, and this is specifically more for squamous cell carcinomas that will develop. So this is something that we can all aim to reduce in our lifestyles. That being said, the most important driver for skin cancers will still be prolonged exposure to ultraviolet radiation. And hence, therefore, if we were to look back at the initial statistics, it's not illogical to understand as to why it is the older age groups, because they are the ones that have cumulative sun exposure over many, many years, and therefore they are more predisposed to developing skin cancers. So to drive home this point further, we know that Singapore sits within the tropical belt. And as such, the incoming UV radiation hits Singapore in a much smaller area and hence higher density and intensity compared to countries of a more temperate latitude. So while some of these UV radiations will get reflected by cloud cover, most of it will still reach the ground surface as filtered UV radiation. So in Singapore, we measure your UV intensity using the UV index, which is a numerical scale, and this is widely adopted by other countries as well. We measure this in Changi from 7 a.m. to 7 p.m. during daylight hours, and the numerical value that is presented is actually the average of the last 15 minutes. So in Singapore, we do get our fair share of rainy days, cloudy days, but by and large, month on month, we are actually in a very high or very high intensity UV index most of the time, as you can see in the bar graph here. So what can UV radiation do to the skin? For one, we have to recognize that there's two. UVA, it can cause delayed tanning, wrinkles, as well as premature aging. For UVB, it can cause sunburns, redness of the skin, irritation to the skin, as well as immediate tanning effect. Together, they are also responsible for causing skin cancers. So this is one of my favorite photographs, for it demonstrates elegantly a split-face comparison onto the harmful effects of UV radiation. So the gentleman in question is of a light skin tone. He works as a truck driver. And owing to his driving posture, half of his face, his anatomical left or the right of the screen, is exposed to the sun compared to the other side. And over time, it's not hard to see that he has developed And in time to come, maybe some skin cancers will develop. So that being said, after UV radiation, as well about this role of high energy visible light. And high energy visible light is mainly derived from the sun, similar to UV radiation. A small portion of it is derived from artificial sources in our environment, mainly electronic devices that emits blue light. And there's been some concern by the members of the public as to whether high energy visible light in the blue light spectrum is actually causing us skin cancers, and therefore, we really should avoid being around artificial sources with blue light in our midst. To that end, there has been an International Commission of Illumination that's based in France, and they published a position statement in 2019 addressing this concern. So what they found was that artificial sources of blue light do not fixate on a focal area of our skin long enough, or not to be highly intense in its blue light to cause skin cancers. But that being said, we do recognize the role of oxidative stress caused by blue light to the skin, and therefore blue light may also cause some skin pigmentation and photoaging effects, but not skin cancers. So our focus today will still be on ultraviolet radiation and how best to protect and prevent our skin from getting more of it. Right, so one of the first prevention tips we're talking about is logically avoidance. So as best as possible, we can adopt certain lifestyle modifications as well as make some clever clothing choices to prevent our skin from getting more UV radiation. For lifestyle modifications, we want to avoid the sun from 10 a.m. to 4 p.m., where this is when the sun is highest overhead and most intense. We also want to avoid the use of tanning beds and suntans as much as possible. And for drivers who spend long time on the road, we could invest in some solar films to. When it comes to choice of clothing, one, of course, we want to pick a clothing that has a very dense and tight weave, for this provides a mechanical barrier against UV penetration. For certain fiber types, it will be very helpful to block UV radiation. For members of the public who prefer more natural fibers, cotton and linens are good materials. And for synthetic fibers or materials, things like polyester, spandex, nylon are good options as well. So we all know that bright colors tend to reflect more light, and this is similar for UV radiation, where brighter colored clothing tends to reflect more light than darker ones. And in fact, some outdoor clothing that's purported to be good for active wear and outdoor usage may also be pre-treated with certain components of sunscreen, such as titanium dioxide, which adds a further layer of protection other than the mechanical barrier when it comes to protecting against UV radiation. And lastly, we want to check whether these clothing are actually water resistant, because for clothing that are not water resistant and once you soak it in water, what happens is that this fabric tends to stretch out, and in so doing, they provide less of a mechanical barrier to protect against UV radiation. So if all this is a little bit hard to consider, too many points to consider before buying a piece of clothing for outdoor use, clothing nowadays do come with a UPF rating, and this stands for Ultraviolet Protection Factor. Is a numerical score, and it assigns a score based on how much UV radiation is being blocked. And this applies across different types of materials as well. So this is a kind of a very easy, handy to use label that you can look out for when trying to buy outdoor apparel. So the next prevention tip, of course, is to use sunscreen, which will form the bread and butter of today's presentation. So in my mind, what makes a good sunscreen? One, it should be broad spectrum. It should be hypoallergenic. It should suit your lifestyle needs. And number 4, the texture should be something you're comfortable with. When we're talking about broad spectrum, what I mean is that it should not just, it should do both. A way to check out whether your sunscreen does both is to look at the ingredient list. If you see things like cinamides and salicylates on them, this is a UVB blocker. If you see benzophenones, it's a UVB blocker. And avobenzone is a UVA blocker. So we are kind of dividing UVA into 2 subcategories of UVA2 and UVA1. So based on that alone, we are able to see how broad spectrum these sunscreens are. But again, for most of us, we are kind of busy with our lives, and we may not have all the time in the world to look through the ingredient list. It's confusing to see whether is it a fragrance, is it an active ingredient of the sunscreen. And helpful, most sunscreens nowadays do come with labels, and they have 2 labelings. SPF stands for protection factor, which grades the level of protection against ultraviolet B, and the PA factor, otherwise known as the protection grade of UVA, which grades the protection against UVA. So for UVB, going back to our earlier slide, we know that UVB rays can cause immediate reddening of the skin. So how this sunscreen measures the protection against how much is able to protect against this reddening of the skin that we are seeing right here. And sunscreens nowadays are now labeled SPF 15, 30, and 50. In the past, we have 100, 120, but now for industry-wide practice, 50, and anything beyond that is labeled 50 plus. It is also good to bear in mind that the relationship between these SPF values are not linear. So what I mean by that is SPF 30 is not twice as protective as SPF 15. In fact, the protective level of SPF 15 is 93%, SPF 30, 97%, and SPF 50, 98%. So next, we will talk about the protection grade of UVA, which is a Japanese measurement system that has now been adopted worldwide. And what it does is to measure the protectiveness level of sunscreens against UVA. So borrowing back to the earlier principle of UVA rays being able to cause darkening of the skin, how this measures is to see how good this sunscreen is. If you see a PA single plus, this sunscreen is able to protect your skin by a factor of 2 to 4 to 8 times, and triple plus more than 8 times. So next, we'll talk about how the hypoallergenicity property of sunscreens. So we know that sunscreens, just like any topical cream that you apply on the skin, may cause skin reactions. And this may actually occur more commonly in patients who are more predisposed to it, such as having conditions like eczema and so on. Interestingly enough, some of these skin reactions may only take place with it being activated under the sun, meaning that if you were to apply it indoors, once you step outdoors into the sun, that's when these skin reactions will occur and be activated by sunlight. So therefore, they'll be termed photoallergic reactions. So to give an example, if you were to use a particular brand of sunscreens and you have used it diligently, copiously, only to find that whenever you step out onto the sun, you start developing red reactions on the skin, you may be dealing with photoallergic reactions. By and large, however, this is not a common phenomenon. Some of these skin reactions can also occur in forms such as hives, and in very rare instances cause respiratory distress. So for more of these sunscreen that causes allergic skin reactions, they are inside what we call the organic sunscreen category. And these organic sunscreens, what they do really is to get absorbed into the skin, absorb light energy, and dissipate it in the form of heat. There is a second group of sunscreen known as inorganic sunscreens, which are generally opaque mineral particles. They do not get absorbed into the skin, they just sit on the skin layer like a mirror to reflect UV radiation. So the rule of the thumb is that inorganic sunscreens tend to be more stable, they tend to be less reactive and irritative, and therefore will not predispose to you having skin reactions that easily. The downside of inorganic sunscreens, of course, is that they leave a very white residue on the face, which can be very hard to clean off. While so on one hand, it does offer very good properties, some downsides to it as well. And for audiences who want to decide whether or not you're dealing with an organic or inorganic sunscreen, that white residue is quite an important telling point between the two of them. So thirdly, we're talking about the lifestyle factors. Some sunscreens have labels as water resistant or very water resistant. And what it means is that it's actually able to maintain their SPF level after 40 or 80 minutes of prolonged water contact respectively. So 40 minutes for water resistant and 80 minutes for very water resistant. So lastly, for the last factor on texture, so sunscreens nowadays come in different formulations. So for lotions and creams, you're actually dealing with oil-in-water preparations. For sprays and gels, by virtue of them being lighter on the skin and being able to evaporate a lot more, they do contain a bit of alcohol in them as well. In a market survey, what they found some favored factors of sunscreen is the absence of greasiness, having a pleasant smell, and having an ease of application. So to use mineral sunscreens once again as an example, we know that they form aggregates of white particles on the skin. Newer technology now allows us to grind down these particles into very fine ones that allow us to spread it more easily on the skin. If these particles are fine enough to be less than 100 nanometers in diameters, they will be termed nanoparticles, and slightly larger than that, micronized particles. So in a way, they blend the good property of a mineral sunscreen with it being more easily applied, and hence, this should be more suitable for public use as well. So to summarize this, my 5-point sunscreen checklist, one, of course, is to look at the SPF factor, to look at the PA factor, to look at the texture of the skin to see if texture on your skin to see if it's suitable for you. Is it hypoallergenic? So how should we apply sunscreen? I would say as much as possible, as liberally as an example of a volume of sunscreen you should apply, because this is something that we all are familiar with and can be all found in most of our households. I would say you need 1 teaspoon volume equivalent of sunscreen to the face and neck area, 2 teaspoons equivalent to the front, and 2 teaspoons to each leg by virtue of it having more surface area. We should try to apply it 30 minutes before going outdoors and to reapply it every 2 hours, especially after swimming or excessive sweating. Because to bear in mind, even for very water-resistant sunscreens, they are only able to maintain the SPF protection level for 80 minutes, which is just about 1.5 hours. So going beyond physical or topical sunscreens, there have been now oral sunblocks that's now introduced into the market. And some people might say, hey, why don't I just pop a pill instead of using physical sunscreens? It is our position here today that physical sunscreens or topical sunscreens should still be the first line for skin protection, but oral sunblock can be used as an adjunct or secondary prevention tip. So for oral sunblocks, there have been some sun ingredients out in the market, such as nicotinamide, as well as Heliocare, which is the brand name for polypodium leucotomos, a fern found in Central America. And is there evidence for this in protecting the skin? The short answer is yes. So to use nicotinamide or niacinamide as an example, we know that there is a skin immune response that is actually helped to guard against skin cancers to survey the skin. So after 6 to 8 minutes of UV exposure, strong UV exposure, this skin anti-tumor response is being dampened. However, in skin that has been treated or patients who have taken nicotinamide, what they found was that this UV dampening effect does not occur, and hence the skin's tumor surveillance system is able to proceed normally to survey the skin for skin cancers. Similarly, for polypodium leucotomos, what they found was that for skin that has been treated or patients who have taken polypodium leucotomos, there is enhanced repair of sun-damaged cells in the skin and reduction of UV damaged DNA products that occurs in the skin. Lastly, the Langerhans cells populations are also preserved in the skin, and this cell is essentially important for tumor surveillance. To drive home this point further, for further bench-side skin models, there are certain unhealthy biomarkers of the skin that will occur after UV light is shined on it, and this will include DNA damaged products, as well as Ki67, which is a growth of, or rapid growth of the skin cells, and this again can lead to cancer. What they found was that skin that has been post-treated with polypodium leucotomos will actually demonstrate less of these biomarkers, and hence there is a protective effect of polypodium leucotomos on skin cells. So then, the next question is, for someone who is very diligent and hardworking in applying sunscreen, taking sunblock and oral sunblock pills and so on, will I get adequate vitamin D from the sun? And vitamin D is important, and part of its sources is from the skin and from the sun as well. This is an interesting question because there have been both proponents and opponents of this topic in this topic question. And the reason why is because there have been many studies that have been done, and they've been done all over the world in different kinds of people of different skin tones and of different activity levels. So some people are more outdoorsy and some are less. In terms of the sunscreen use, both in terms of the type of sunscreen used and the volume which they apply also differ. And of course, how much they use and how much they reapply as well. That being said, after weighing through all of these studies, what they found was that the weight of evidence from these field trials and observational studies still favor the fact that the risk of sunscreen use affecting vitamin D is low, and hence it is still safe and healthy to use sunscreen. So I've come to the end of my presentation today, and I just want to leave a capsule summary for everyone to just remember the term or the acronym NCIS, really to avoid, to cover, of course, to use your sunscreens. So with that, I've concluded the first presentation for today. Thank you.
Thank you, Dr. Mark. Thank you so much. And we have to apologize for the audio technical issues that we have along during Dr. Mark's presentation. We are actively resolving this. We hope this is not happening again. It's something that we try to resolve as it comes and making our precautionary. But so we ask for your patience and also again apologize for any inconvenience. The next speaker we are welcoming today is Dr. Adeline Yong. She is a consultant from the Division of Dermatology and Department of Medicine from NUH and also a consultant with NCIS. And Dr. Yong says, how do I know if I have skin cancer? Dr. Yong, over to you.
Good morning, everyone. I'm Dr. Adeline Yong from NUH, and I'm very happy to see all of you here on a Saturday morning at our Skin Cancer Public Forum. So without further ado, let's talk about how do I know if I have skin cancer? So firstly, let's talk about cancer in Singapore. So some of the statistics have been alluded to by Dr. Mok earlier. And from the 2021 Singapore Cancer Registry annual report, cancer cases have actually been increasing over the years, and the number of people living with cancer will continue to increase. So during the period from 2017 to 2021, 84,000 cancer cases were reported in Singapore. And as we can see, non-melanoma skin cancers are accounted for about 5.2% of cancer cases in males, as well as 4% of cancer cases in females. Now, this article was published in September last year, and we see that in those above 65 years old, the number of people diagnosed with non-melanoma skin cancer has actually more than doubled over the past 50 years, from about 48 cases per 100,000 people and to 110 cases per 100,000 people. So with all these scary numbers and as skin lumps and bumps are very, very common, it is understandable that one may panic and ask the question, how do I know if I have skin cancer? So the short answer is that, unfortunately, there is no 100% way to know if you have skin cancer or not without seeing a doctor and doing a biopsy for confirmation. However, there are some ways and tricks to alert yourself and suspect if you may have skin cancer, which I will share with you today. So, for today's agenda, we will first talk about who are at higher risk of skin cancer. We will then discuss what features to look out for to suspect if you may have skin cancer. And finally, we will look at some examples of cases which we encounter in the clinic. So firstly, who should be more worried that they are at higher risk of skin cancers? So the following table shows some risk factors for skin cancer. If you fall into the following categories, then you should be more suspicious if you may have skin cancer. As shown, certain non-modifiable risk factors include having a lighter skin color, a personal or family history of skin cancer, and having a history of inherited cancer syndromes. Modifiable risk factors include exposure to UV radiation, recurrent episodes of sunburn, tanning bed use, and having a weakened immune system, for example, with use of long-term medications which suppresses one's immune system. Next, I will share with you the ABCDE rule so you know when to suspect skin cancer early. Let's have a look. So the A stands for asymmetry. The left picture shows a benign mole, and the right picture shows a cancerous mole. To assess for asymmetry, we usually draw a line down the center of the lesion, and a cancerous mole may not look the same on either side. In contrast, a normal mole is typically similar on both sides. B is for border. So the border of a cancerous mole, as seen on the right, may be irregular or blurred, and a harmless mole, as seen on the left, is likely to have well-defined borders. Next up is color. So a harmless mole, as seen on the left, tends to be evenly colored, usually a single shade of brown. In contrast, having a variety of colors is another warning signal. So different shades of brown, black, or even red, white, or blue may appear, and this should alert you to suspect skin cancer. The diameter of the lump or mole is also important. It may be a warning sign if it's larger than 1/4 of an inch across, or 6 millimeters, which is about the size of a pencil eraser. And finally, E stands for evolution or change. So be on the alert when a mole starts to change in any way. And what do we mean by change? So if there is any sudden change in the size, the shape, elevation, or if another symptom such as bleeding, itch, or pain arises, then you should definitely see a doctor for further evaluation. So finally, let's have a look at some examples and determine if we should be worried about cancer. So first up, we see this lump on the scalp of a 50-year-old man for the past 10 years. What is this? Do you think that we should be worried about this? I'll give you some time to think about it. Okay, so as we can see, it looks very symmetrical. There's a uniform color. The borders are also very well defined. So we don't really need to be too worried about this lump. And what is this? So this is a seborrheic keratosis, which is a common harmless skin growth. No treatment is usually required unless they are itchy or bothersome. And there are certain options that we can employ in the clinic, which includes freezing. We can scrape it off. We can also burn it off with electrocautery surgery. Next up, we see this lump on the calf of an 18-year-old boy for the past 2 weeks. Do you think that this is a cause for concern? Okay, so if we look at it closely, this is a very well circumscribed lump. It is very symmetrical, and it's only been growing for the past 2 weeks on a very young patient. So this is a viral wart. So viral warts can arise anywhere on the body, but it's most frequently found on the hands and feet. They are caused by a certain subtype of viruses, and they can be spread from one person to another person and from one part of the body to another part of the body. They may disappear without any treatment. However, in most cases, elimination of warts can take time. So common treatment options would include creams, freezing, we can burn them away, and we can also perform laser surgery for this. Next up, we have a bleeding lump that has been growing on the left cheek of this elderly lady. Do you think that we should be worried about skin cancer in this lump? So as you can see, it is very asymmetrical, and there's some ulceration on the surface of the lump. As we heard earlier, this has been growing on this lady's cheek, and it has been bleeding as well. So we should definitely be worried about it. And this is a squamous cell carcinoma, or SCC, one of the top 3 most common skin cancers, which we see in the skin. So SCCs can appear as scaly patches, open sores, or raised growths with central depression. They most commonly arise in sun-exposed areas of the body, and other risk factors include ionizing radiation, arsenic exposure, and immune suppression. Number 4, this is a growing painful lump over this lady's left inner eye. Do you think that we should be worried about this? So as we can see, it is very asymmetrical. If we draw a line down in the middle of the lump, the left side may not look similar to the right side. The borders are also very irregular. We can't really tell where the margins of the lump extends to. It's very irregular, and it's been changing in size. So we should definitely be worried about this. And this is a basal cell carcinoma. So a basal cell carcinoma, or BCC, is the most common skin cancer worldwide and locally. A lot of times, they have a pearly raised borders with visible blood vessels when you examine it closely. Sun exposure can increase the risk of BCCs, and because BCCs grow slowly, most of them are curable when we catch it and we treat them early. However, untreated BCCs can grow wide and deep into the skin and destroy skin, tissue, and bone. Now, for the next case, we have a mole on the cheek, which has not changed in this lady for the past 30 years. Should we be worried about this mole? So as we can see, the mole is very symmetrical. The borders are very regular. There's one single shade of brown, and it is a very small mole. Its diameter is less than 6 millimeters. So nope, we don't need to be worried about this mole. And let's look at other types of moles. So moles are one of the most common skin lumps that we can find, and they are actually caused by a cluster of pigment-producing cells in the skin, and its color depends on how deep the cells are, as they can even appear blue if clustered deep in the inner layer of the skin. Most moles are flat, but they can also be raised, and most moles appear below the age of 25. However, lots of sun exposure can increase the number of moles that you can have, and so can using certain medications, such as those that suppress your immune system. Case 6. So this gentleman was seen in the clinic for a mole which has become bigger and bigger, as well as more lumpy over time. As you can see, it is not symmetrical, its borders are very irregular, and there are different colors within the lump. You can see colors of brown, white, or even blue. There's even some crusting, some yellowish crusting at the side. Should we be worried about this lump? So definitely. So this is a very worrisome lump. It is a melanoma, and a melanoma arises when cancer cells form in melanocytes, which are cells that color the skin. It is less common than the basal cell carcinoma or a squamous cell carcinoma. However, it is more likely to invade nearby tissues and can spread to other areas of the body. Melanomas can arise on any area on the skin. However, it is most commonly found on the chest and back in men, as well as on the legs in women. Moving on, our next case is a 50-year-old lady with a brown lump on her thigh for the past 5 years. There has not been any change, and when you press the surrounding skin, it produces a central dimpling, which is what we can see on the right side of the screen. So essentially, it sinks down. So this is what we call the dimple sign. And should we be worried about this lump? Well, the answer is no. So this is a dermatofibroma. It is a very common and benign skin tumor, and we most commonly find it on the legs in women. We usually leave them alone. However, we can also cut it out if patients are keen to. Concurrently, this lady also tells us that she also has another lump over her upper back. So when we have a look at it, it's been stable over the past 5 years, and this is a very smooth and firm lump with an overlying visible black mark that we can see on the skin, which we refer to as the punctum. Is this worrisome? And should we suspect skin cancer in this lump? So again, if you have a look at this lump, it is very symmetrical. It has a uniform colored, skin colored, and its borders are pretty well defined. So this is an epidermal cyst. So an epidermal cyst is the most common type of cyst that we can find in the skin. And essentially, it's made of a capsule filled with keratin, which is the structural material that makes up the outer layer of our skin. It can sometimes be inflamed, and you may see it becoming painful, red, or swollen, or even discharging a cheesy white material. Cysts can usually be left alone, but if it's inflamed, we can excise it. Next, this has been present on this lady's thigh for the past 20 years with no change, and it's not painful. Do you think that we should be worried about it? Okay, so if you have a closer look at this lump, you can see that, again, it's very symmetrical. There is only one single shade of a skin color, and as mentioned earlier, there hasn't been any change to the lump at all over the past few years. So what is this? This is a lipoma, and it's a benign lump made of a collection of fat cells growing in the deeper layers beneath the skin. Like cysts, they are very common and sometimes arise after injury to the site, although its mechanism is not well understood. So we usually leave them alone. However, if patients are concerned or if it's bothersome to the patient, we can also excise them. And finally, these little bumps have been present over the past 5 years in this lady without any change. Should she be worried about skin cancer? So the answer is no. As we can see, these are very uniform, regular bumps on her neck, and each bump is very regular and symmetrical. What are these? So these are skin tags. So skin tags are harmless skin growths that can appear anywhere on the skin, but often develop on the neck, eyelid, or underarms. They may be the same color as your skin or darker. You may see one dangling from a stalk, while another can be firmly adhered to the skin. Most cases can be left alone, but if our patients wish to remove them, then options would include freezing them away or burning them off. So finally, I would like to leave you with a few take-home points from today's talk, which is number 1, to pay attention to the ABCDE rule of skin cancer. Take note of any worrisome lumps or changes to your skin. For example, if there's any rapid growth, if there's any pain, bleeding, if there are new symptoms that occur, and also to beware of new moles or lumps that can arise. Thank you.
Thank you very much, Dr. Yong, for your sharing. We are now welcoming our next speaker, Associate Professor Peter Goen. He is the Senior Consultant from the Division of Dermatology, Department of Medicine from NUH. His topic of sharing is treatment strategies for skin cancer. Over to you, Prof. Goen.
Everybody, got
Morning.
no conflicts of interest to declare. As we saw earlier, the 3 most common skin cancers in Singapore and the whole world actually, the first 2 comprise the very large majority of non-melanoma skin cancers, and this is a term that you'll see a lot in research and in the papers. Our skin cancer is a big problem in Singapore, so we have to focus on Singapore, and I've tried to find a lot of Singapore-specific data. So Singapore is an equatorial country in Asia, Southeast Asia, and this paper that I wrote with my British Nigerian resident basically tried to highlight that even though you have darker skin, you can still sunburn. But the amount of melanin that we have in our skin is actually a protective factor. And a lot of papers that have looked at this fact is that they publish stuff that says that it's approximately SPF 15 or 20 is a natural protection from the melanin in the skin of someone with type 5 or type 6 skin. That just gives you a scale of how dark the skin is. So in Singapore, this is an important paper that basically tracked the BCC, the SCC, and the melanoma, the 3 cancers that we talked about earlier. Chunchat's paper basically has collected all the cases from 1968 to 2016. So we are missing, 6-7 years worth of data, but I'll get him to make sure that we update the literature. He basically found 12,692 cases registered with the Singapore Cancer Registry. Okay, and there were 8,367 cases of BCC and 3,598 cases of SCC and 727 cases of melanoma. This is an important figure from that paper, and I'll try to point out some important things for you to look at here. You can see that the BCC trend is basically rising, steep. It's a steep rise in the Chinese and rising also in the Malays and rising also in the Indians. Because the Singapore paper has split the three cancers into racial incidence. So it's really important. Yeah. So the fairer skin, as we already talked about, has the least amount of protection against UV exposure and consequently develops the highest incidence of skin cancer. For the SECs, you can see that essentially the trend line over the years hasn't moved very much. May even be going down slightly for Malays and the Indians. And lastly, the melanoma, luckily, stays fairly flat because this is the most dangerous of the common skin cancers. This is a table 3 from that paper. Again, it's important. You can see the vast differences amongst the races, Chinese, Malay, Indian, for BCC, similarly, SCC, similarly, melanomas. It's very, very stark, and it reinforces basically the message that I wanted to give you from these 2 or 3 slides, that the pigmentation that we're born with and the pigmentation that we develop is very important in protecting. And because these things are something you're born with, you don't have a choice, you have to put on the sun protection. And that paper that I talked about earlier, even though your skin is dark, it doesn't mean that you don't sunburn and you don't get damaged. It's very important to protect your skin as well, because you can still develop skin cancers. So what are the most important treatment principles? You can speak to any surgeon, any cancer oncologist. If you have complete removal of the cancer, all the tumor cells, using whatever treatment option you want to use, you get a cure. If you remove the whole thing, okay? And partial removal obviously leaves some there, and that's dangerous as these can progress. Sometimes in very, very elderly, and if the patient or the family do not want to do anything at all, then observation and surveillance can be an option. And lastly, of course, palliation, which is end-of-life care. So moving back to basal cell carcinoma. Basal cell carcinoma is by far the most common of all the skin cancers worldwide, and in Singapore is the most common human tumor, human cancer, okay, by far. And you can add in nearly all the other cancers together, and they still will not beat basal cell carcinoma. You saw the large numbers that we had in the earlier slide, and in the UK, we're talking about 200 to 250,000 cases a year, okay? But that's just to give you a comparison of population in a temperate country, which is over 10 times the population size of Singapore. There's several clinical variants, and I'm not really going to talk too much about them because they're mostly clinical. Some of them are histological. That means you only diagnose them after you have taken the whole thing out, or you take a chunk out. So the nodular, the round, ball-like lesion with or without an ulceration, some ulceration in the center. Histological groups can include infiltrative, which is more aggressive. I haven't written it down, but again, there's a micronodular group as well, which is also a histological diagnosis. The superficial type, basically the BCCs that spread, then grow generally sideways, mostly, and then later on they will also go deeper. So this one, because it's so superficial, the treatment options are many, and we'll be able to get rid of it more easily. The morphic basically means the scar-like version of the BCC, and this one can be very difficult to diagnose as well. Basosquamous is an important variant because they have features of both the squamous cell carcinoma as well as the BCC, and consequently this is the type that is thought to spread later around the body if it does spread. But spread of BCC is generally very, very rare. This paper here was undertaken because we read a paper from New Zealand that told us BCCs grew faster around the eye. And I wanted to know whether this was true. So we basically measured the growth rate, and the term that we use and used in the literature is a tumor volume doubling time for BCCs found around the eye and other parts of the head and neck area. And the results were clear. BCC is a very slow-growing tumor. On average, it takes about 150 days or thereabouts for a tumor volume to double. And we did not find that the ones around the eye grew faster than the ones on the other part of the head and neck. As you can see here, the periocular ones around the eye is 177 days, and the head and neck ones were 129, 130 days, thereabouts. So there's no evidence that the previous published paper was correct. Best treatments for basal cell carcinoma. You can see here, the nodular ones are very amenable to excision or surgery. Just cut the whole thing out with decent margins, and that's it, it's gone. The superficial ones, you can use topical things. You can put creams like the 5-fluorouracil, imiquimod. You can excise it, you can burn it, you can freeze it, etc. The scar-like ones, best treated with Mohs micrographic surgery, or just cut it out with large margins. And basosquamous ones, I told you earlier that it's most dangerous and most aggressive ones, basically surgery with or without adjunct treatment. Some of these other treatments which are available, photodynamic therapy, radiation, and a class of treatments using monoclonal antibodies and targeting the hedgehog inhibitors, vismodegib and sonidegib. For SCCs, again, the same principle applies. Complete removal with excision or ablation. You can use shaving, curettage, burning with electrocautery or laser. You can use aggressive freezing, like cryotherapy. Again, Mohs micrographic surgery, very useful for defining whether the tumor is completely out, and radiation. For the advanced ones, the dangerous ones, the high grade or those that have spread, then we're talking about a combination of surgery, radiation, a very useful treatment called cemiplimab, which is immune checkpoint inhibitor for the PD-PDL1 class, and also EGFR inhibitors. So we come now to melanoma. Again, Singapore-specific data, not that much, but here I want to highlight that we had some good work done from residents and our team in SGH, NSC. They didn't find a huge number of melanomas, but useful as well because we need a perspective from Singapore. What about their data? Basically, in Singapore and Asian populations, the acral lentiginous melanoma constitutes the dominant majority of all the total melanomas that we find here. Whereas in the West, and most of the published papers from Western countries, you get superficial spreading melanoma, large percentage, by far the dominant type, lentigo malignant melanoma, and then nodular 15%, and only 2 to 3% are the acral lentiginous type. This is a very important point to think about because here, most of our type that occur are the acral lentiginous, and these are the ones which tend to be diagnosed later and carry a worse prognosis. Whereas something small that's diagnosed quickly on the skin, other parts which are sun-exposed areas, especially with the SSMM or the lentigo malignant melanomas or the nodulars, usually they get picked up earlier. Surgery, which my colleague, Dr. Mark, will talk about shortly. Wide local excision, plus or minus something special called sentinel lymph node biopsy. We have an arsenal now of drugs which is constantly increasing, targeted treatments specifically for mutations, immunotherapy, which is a huge field which has exploded in the last 10 years, immunomodulatory treatments, and radiation. Standard chemo is not routine for advanced cancers of melanoma. So very briefly, just to highlight some of the superstars in science which have allowed the field to advance so rapidly in the last 10 years. That's James P. Allison, who basically found the pathway for the CTLA-4 immune checkpoint, and Tasuku Honjo, who found the pathway for PD-1, PDL1. This slide is just to remind me to let you see that there's been so much work with all these different immune checkpoint inhibitors and the combination trials that will basically showing us which combinations work best. So very good slide just for that point. Most people will recognize this chap is Wolverine from the Marvel Comics. Actor is Hugh Jackman, who basically suffered and has suffered from several basal cell carcinomas over on his nose, and he's had quite a lot of treatment for it. He's a very strong advocate of sun protection, being Australian, growing up in ozone-depleted atmospheres, and getting so much sun. So I just want to conclude there very briefly. Prevention is really important, It's not a treatment per se, but the earlier you can diagnose a pre-cancer or a early cancer is the best. If you get rid of it, then you can remove all the dysplastic cells. At that time, you've cured. Okay? And point number 2, complete removal of the cancerous cells themselves equals a cure. And recently, over the last 10 years, we have some highly promising treatments for late-stage cancers. So with that, I've finished. Thank you very much.
Thank you, Professor Gun. Thank you so much for your presentation on the treatment strategy for skin cancer. And welcoming our fourth speaker, Dr. Mark Edward Puhendran. He's the head and senior consultant of the Department of Hand and Reconstructive Microsurgery in NUH, also a senior consultant in Division of Surgical Oncology in NCIS. And Dr. Mark will be addressing the topic on can skin cancer grow underneath my nails? Over to you, Dr. Puhendran.
Thank you very much, and good morning, everyone. Maybe I'll start with a poll question first, because it seems a bit strange, right? First of all, I'm a surgeon, and I'm talking about skin cancer, not like my skin doctor colleagues or dermatologists who are talking about skin cancer. The next thing is I'm talking about nails. So I guess the question I'd like to ask everybody, what do you think? And we'll put up a poll question now. Can skin cancer grow underneath my nails? If you could please answer yes or no. Because I guess they'll decide whether I need to continue my talk.
Sorry.
Okay. So I guess the majority have said that yes, it can, and I guess that's actually why I'm here to give this talk on skin cancer and how it relates to the nails. Actually, my colleague Professor Gun mentioned a bit earlier actually that we may have a larger proportion of skin cancers in the hands and feet, and actually that includes the nails too. And that's why actually it's not something we think about, but it's something that we would like to ask everybody to keep a lookout for, because this is where we frequently encounter actually what we call late presentations, when patients come in late for treatment. Now let's start first with what we call the nail complex. We can all take a look at our own fingers, or maybe even our toes if you can see them. This is actually a picture of my finger which I took, so I use that as an illustration. So when we talk about nail, what are we talking about? Not actually the nail itself that we are looking at. We're actually talking about a few different structures that we call, number one, the hyponychium. Number two, the nail plate. That's the nail we actually talk about. That's actually some, what we call the nail bed underneath. And then, of course, there are the nail folds which are on the sides. And actually the nail folds, these are actually skin. So, of course, then if they're skin cancers can arise from them. But if we actually take out the nail plate or the nail that we call, this is actually what it looks like underneath. And this is a normal nail bed. It will just remove because we need to remove the nail. But you can see there's actually live tissue underneath, and that's where sometimes skin cancers can also grow from this. If you look at this slide, the side view, if we this is actually what it looks like under what we call histology, when we preserve the finger and then we look at it under a microscope. Let me show you this. So what we can see here, that's actually the bone, and that's the skeleton or the base on which everything lies on. On the front, that's the pulp, which in the fingertip is very special because we use it to feel and to hold things. And then on the back, this is actually the nail complex. The structure on the top where you can see the arrow pointing at, that's the nail plate. And below that, it's actually the nail bed. And if we're talking about skin cancer arising in the nails, a lot of them actually arise here in what we call the germinal matrix. And that's the main growing area for the nail, and it's actually hidden underneath the skin. So the next question is, my colleagues have already shown you what cancer looks like in the skin around the body. How about skin cancer in the nails? So please take a look at these two pictures here. And then we're going to have a second poll question. Which picture, my question is, which picture actually shows a cancer? Picture A or picture B? Please submit your answers. Okay, thank you very much. So most people have said that it's actually picture A, and the correct answer is, well, it's actually picture A. I'm trying to make picture B disappear now. Okay, now picture B has disappeared. So this is what skin cancer, specifically malignant melanoma in the nail, looks like. Now, of course, we don't want to see the doctor when it reaches this stage. Are there any ways, is there anything we can do to try to basically detect this and seek attention earlier? Let me see whether I can advance this. Okay, before that, what are possible contributing causes to developing skin cancer in the nails? And actually, it's quite similar to skin cancers in all the other sites. Age, something we can't modify. Smoking, that we can modify. Unfortunately, in the nails, they tend to be hidden away, so actually sun isn't a big factor in developing skin cancer around the nails. Things like radiation exposure doesn't really happen unless you're working with radioactive materials. Some people get burns or trauma and can develop a skin cancer in the nails there. Whether or not chemical exposure may cause, it won't be the normal soaps and everything used for washing, some irritation. This will be more caustic chemicals that may cause damage repeatedly. And of course, sometimes a family history. If you have family members who have developed skin cancers, particularly around the nails, then this may be something that will cause us to worry more. Now, if it's difficult to recognize skin cancer in the normal skin, then it's even more difficult to try to pick it up in the nails themselves. Because, quite often what we see as a first sign is that the nails have changed color. They become pigmented. And what may cause pigmented nails actually? There are many different reasons. We can have just more pigments there. And some of the things that can cause it, you can get an injury, which is by far the most common. You may be taking some medication that can change the pigment levels. Some races have more pigmented nails. Sometimes, if you're pregnant, you may develop it. And then some other medical conditions may also cause it. Even simple things that's very common, especially for some of us in the army, in our boots, infections from fungus in the toes. Then sometimes the pigment cells, more of them may grow, but then they can be, majority of these are actually non-cancerous growth, and less of them are actually cancerous growths. And finally, the most common reason why we get pigmented nails, because of bleeding. We injure them, there's some bleeding underneath the nail, and then, we've all had it sometimes when our nails, you knock it around, especially in our feet, you go for a long run, and or you have bad fitting shoes, and you see, the nails actually change color, and some of them may actually fall off. So these are by far more common causes of pigmented nails, not cancers. So how do we try to recognize it? What do we look out for? So if we see that there's actually, what we're looking for is change. If we see that there's actually a streak that's been there for a while, but it's getting bigger, or the color is changing. Secondly, as I mentioned, the color changes. It's changing. Third thing, the nail starts getting destroyed. It doesn't look like a normal nail anymore, like what you can see here. If it starts getting discharged or starts bleeding. And then finally, if it's actually, there's a wound there, there's an ulcer, it's not healing. Normally wounds will heal within a few days to weeks. Here, this thing's not healing at all. Then we'll be worried about it. How do we, when we see the patient, how do we assess? My colleague Dr. Yong mentioned the ABCDEs of normal skin cancer. It's slightly different in the setting of nails, but this is something that we use to assess. But even then, despite this, how do we actually know? And that's when we get our dermatology colleagues. They take a more detailed look with their dermoscopes, and then they can see it with greater magnification. These are some of the things that they look at. How's the color? What does it look like? What's the thickness of the bands? How widely are they spaced apart? And with that, they can actually advise us, the surgeons, okay, this one looks really suspicious. We may need to take the next step. And that next step would actually be to do a biopsy. Now, biopsy means it's actually a small surgical procedure where we actually have to remove part of the nail, and then after that, cut into the nail growing area or the nail bed, and take some of these tissue out and send it to look under a microscope. Now, why we are reluctant to do this immediately, unless there's a need for it, is because we can cause problems. Let me just show you an example. I hope nobody's too scared by it, where you actually have to remove the nail itself and then go to the main nail growing area, which is the germinal matrix, take some of the tissue out and send it for tests. So you can imagine if I'm taking tissue from the main nail growing area, it may cause damage to it and it may cause a permanent nail deformity. So it's a difficult challenge we have, whether or not to do a biopsy. But I guess it's still better, even if we have to cause some issues, it's still better than not diagnosing a cancer. And we like to diagnose the cancers early so that we can treat them early. How can we treat nail cancer? Similar to all the other treatment modalities that my colleague had mentioned, Professor Goon, we can do surgery, and surgery is preferred because if we can remove all the cancer, that gives us the best chance of cure. Besides that, the other cancer treatment modalities are there, but it will depend on many other factors like the type of skin cancer that we're treating, as well as the stage of it. So, if I could conclude, first of all, skin cancers can grow under the nails. Unfortunately, our nails are not immune from this disease, and we do need to keep a watch on it. Secondly, even though they are rare in the nails and there are far more common causes of what we call nail deformity, they can be deadly. And part of the reason why they can be deadly is because we don't think about it, and patients come to see us later on when the disease has progressed. So that makes early detection all the more important. And it is true, even we as doctors would struggle to recognize them sometimes. And the most important things that we need to watch out for are firstly, enlargement, broadening of these brown streaks that we see in the nails. Secondly, change in the color of it, both in the skin around it or within the nail itself. Thirdly, if you start developing chronic discharge or bleeding from that lesion. And fourthly, if you develop a non-healing ulcer or wound. With that, I thank you very much.
Thank you, Dr. Puhendran. How are you? I think Dr. Puhendran and I see each other once a year whenever we talk about skin cancer. So it's good to see you again, sir. And we are actually having a patient sharing right after this. And please allow me to bring up the correct screen. And ladies and gentlemen, please, I know you can't put your hands together, but we are now having Mr. Muhammad Alam. He is on screen now. Yes, the man in blue checks. How are you, Mr. Alam?
I'm fine, thank you so much. Hi everyone.
Do you prefer me to call you?
Today.
Sorry. Morning.
Alam.
Do you prefer if I call you Alam? Alam. Hello, Alam. Yes, Alam. And Alam's going to share, on how he first found out his condition and treatments, etc. And so let's come to this. Can you give us a short introduction about yourself, Alam?
Yeah, my name is Alam, and my age is 42 as of now, and I have a family. I have 2 kids. There's one of a 13 years old daughter and 8 years of a son. So I've been in Singapore about 24 years living here, and I'm working in steel industry. So as a production officer, so I'm handling rough industry working. So that's myself as of now.
Do you work under the sun?
Previously, yes.
Previously, yes.
Since 2000, year 2000 to 2008, yes, I was under the sun work. After that, on and off. And after 2015, it's become more less and less. And currently, yes, sometime, but not at all. So currently reduced.
And the
I think
timing
about
that you will
90%.
work under the sun? I see. And the timing that you will work under the sun, what kind of timing were you working under the sun?
It's a whole day, about 10 hours. It's a morning to until evening.
Oh, wow. Okay. And how did you find out that you have skin cancer? You are a survivor of skin cancer. And what are the signs or symptoms, And yeah.
Actually, this is the interesting question. Normally, since year 2000, used to go to one same barber shop to cut my hair. So they know me well at the Jurong Point. So since year 2000. So every month I go there. So they know me well. And last 2 years, one of the barber, he noticed there's one black color is a spot here. So under my hair. So he asked me what happened. It is that I say I didn't notice that. What is that? Then he said I also don't know. After that I didn't really care about it. So a few months later, again he asked me, hey, it is getting bigger and bigger. Then I say okay. Then I start to observe. After that, I keep when I observe it closely, then I felt that when I sweat, I feel it a little bit itchy. When it's itchy, then I try to wash my face and take a tissue and wipe it off and feel better. So after that, I feel that is something's wrong with it. Then I go to my company clinic. I ask the doctor to look at it, and the doctor asked the nurse to find a specialist and then try to get the appointment. So that last year, I got a chance to see the doctor and then go to the biopsy. The doctor said need to biopsy, but take the picture. Once take the picture, the doctor says it could be a BCC. So you need to confirm it by biopsy. So after that, when I learned about BCC, it was new to me. It's a new term. I didn't know about it. So when the lady doctor, she explained me, say no need to be worried. It is common in Singapore and around the world. Then I say, okay, no problem. I just take it easy, not so serious. After that, I have an appointment in 2023 on 15th of February. Then Dr. Paul, he surgery and took 3 times to remove the whole things. So once, twice, and third time he took off the whole skin. And as of current situation, I feel it's better. A little bit is still got numbness, but it's cured. Thanks to Mr. Paul, Dr. Paul, and thanks to NUH. And maybe you ask me how you feel. Actually, when the lady doctor, name I forgot, sorry to say, said that actually this BCC is normal and no need to be worried. So I didn't take it so serious as I have to feel so complex. No, I just enjoy it and as a normal life, as a normal working, everything. Even but one thing, I did not share it with my family or anyone. I didn't share it. So they may feel a little bit complex or difficulty. They didn't know about it. So if I'm going to explain, then they might worried about it. So I didn't share with them. So I keep it myself. I just share with my colleagues at the office. So they say, okay, keep continue, go to hospital and treat it. So after that, as of now, I'm feeling well, thanks to NUH, all the team, and thanks to my company to support me as well.
Thank you. So I have a question is that now that you never tell your family, when you're with your children, do you look at their hand and skin and their head and things like that to see, there's anything that looks similarly that you need to be worried about?
Actually, after when I diagnosed and confirmed I have BCC, so already visit my family and I look at them, everyone. There is nothing is such thing. So because they always almost every time they're not under the sun, because the children is go to school here and they are not really so facing the sun. When I understand about BCC, how it caused, how it comes in, so even a family member, others, my parents also not really facing this. Actually, what's the main reason why I not share with them? Because already I visit myself, my eyes already, I check them whether I have such a symptom or not. Besides that, I just don't want to misunderstand, misperception about BCC. They may think that this is like other the dangerous cancers. So that's my worry, is if they think that every day they will depression. The family member, something's have happened like that. That is one is the cause is I did not share with them. I keep hush. So finally, I'm cured. I have the next
That's great.
appointment to just for check is in year 2024 next year, just for a look. How is it?
That's good. When your appointment is far away, means that you are in good hands, and they just do regular checks to just follow up with that. So do keep your appointment, and congratulations. And when you were seeking treatment, were there any discomfort? Did you feel any inconvenience?
Actually, no. I was enjoyed the process and progress. I didn't take so serious, means as a first stage I told you. The doctor give me the whole picture, whole the progress, what will happen in next one by one, all the steps. Then I was make it in my sense clear, very clear step. So what it will going on and going to be. So I just relax, and one by one, all the steps I just follow. So I don't really face so much challenge. Yes, after the surgery, few days and few weeks, it was a little bit challenge for me because there's a numbness. When I touch it, there is no feeling at all. So slowly now I recover. Almost 95% I recovered numbness. A little bit only some time, but it's overall good.
You have surgery. Did you have radiotherapy, chemotherapy, further
No.
treatments? No.
No.
So it's a surgery that has removed the whole lump,
Skin.
and then
Yeah.
skin and the lump.
Yeah.
And you mentioned that it's actually near your sideburn. So
Yeah.
did it cause a bald patch there, or your hair actually grew back from there?
Sorry again.
I said you mentioned it's somewhere near your temple, near your sideburns. So
Yeah.
did the hair grow back onto your scalp, or it
No.
becomes a bald patch
No.
now?
Yeah, bald patch. It's no grow back, because they pull the skin from below to above. They just cover it nicely, so it's bald, not grow back. But it's a small
So you
issue.
got a
I don't
facelift.
mind it. Yeah,
Okay.
it's a
So you got
small
a
area,
facelift
so I
from the
just don't mind.
surgery then.
Yes,
That's
correct.
good. That's good.
I just don't mind.
That's great. That's great. And is there something the doctor said to you that you should, do a slight change or change in your lifestyle now that you have recovered from BCC?
It just advised that to use to avoid the sunburn. Avoid sunburn. If I
Do you
really
get a
need
lot
to
of
go,
sunburn
so use the
previously?
cream. Yeah.
Use the
So
cream.
just this no other thing to change anything. Dr. Paul said, don't have to worry, just as a normal life. You don't have to change anything, any food or anything. Just normal.
Just normal. And these days when you go out, do you wear a hat or do you put on sunscreen?
Actually, I use hat, not the sunscreen, because sunscreens make me a little bit discomfort, so I don't use.
Okay, that's good. And looking at your experience, right, what would be something you want to share with everyone or advise everyone who today participated in this webinar based on your experience? What would you want to share? You know, you're someone who has discovered, and the discovery was through a barber, through a hairdresser. You know, and I guess it makes sense to have long-term relationship with your hairdresser, that they will watch out at least, you know,
Yeah.
and he's treated you as a friend. So, what is the advice, you know, to the participants in the audience today?
To me, as of my opinion, I'm lucky. I'm very lucky that similar barbershop I visit every month. So they notice this and then tell me this situation is happening. So that because this area is normally under the hair, you know, under the hair, so cannot see as well as normally. Even when I see the mirror, see my face also cannot notice is under this. Just sometimes I feel a little bit of about half of swollen on my skin, but this is like normal. And normal is sometimes itchiness is normal, also not much issue. So my advice to the nation, or advice to the friends of everyone, that please be aware of your skin. If there's a black color or got a spot, it's more than about 9 or 10 is growing fast, or maybe after a few months it's changed, please visit a doctor. And also just now the doctor was advised in the screen that I saw is really is a helpful information that see the shape and it's
Shape.
how it's color. Actually, before I didn't know, but now I very clear on it how to at first determine it. So if there is not really forming, it's a nice shape. It's like a mountain different area. It's a little bit worryable. So if really grew within few months, more than 10 or more than 6 as immediately go to see the doctor. This is my advice.
Do now your friends and colleagues come to you? Can you take a look at this? You know, I have this on my skin. Do I have to worry about? Do they come to you now?
Actually, so far with my colleagues, with my friends and family, this type of situation, I don't see anyone so far. But if I see one of my brother is far brother, so I just saw him some black spot on the hand. So I try myself to see the house, the shape, so and the color. So I saw it's in a very round shape, and it's formality, if not so, you know, like here and there. So, but I told him to look for a dermatologist to ensure that this is the good or negative sign. So he till now I never know. Is still he concerned about it or see the doctor.
My screen, I was told that my screen was frozen. I believe you have actually explained to everyone already that your friends are all asking you
Yeah,
about
yeah, yeah,
check.
yeah.
Yeah, that's
Yes,
great. That's great. Um, Thank you, Alam, very much for your sharing today. Please stay on screen. We're gonna now go into the
thank you so
Q&A
much.
section, and so that we are looking at questions from the audience and see that we have quite a lot of questions. So, doctors, are you ready? Please, yes, we can see the panels are all there. Thank you very much.
Thank you.
There's quite a lot of questions. I mean, we're looking on screen, there's 32. I'm sure you'll come up with others too. I'm just going to rattle off a couple of questions. All right. Number one is this: as we age, we have uneven skin discoloration from bald patches, you know, to sometimes women, menopause, freckles, and all these things. Are these cause for concern?
So I
Dr.
guess
Young,
it's
we can't hear you.
Can you hear me now? Good. Okay. So maybe I'll
Yes.
take this question. So as we age, I can see the question. We may have uneven skin discoloration with brown patches. There are actually several reasons for this, and A few of these diagnoses can either be, solar lentigos, which is what we call sunspots, seborrheic keratosis, which is what we call age spots, or even melasma or other pigmentary conditions. So I guess to determine whether they are causes for concern, you should actually see a dermatologist or a doctor for further evaluation. Only then can we actually examine the lesions properly and come to a proper diagnosis to guide you and to explain to you whether you should be concerned about skin cancer.
So the question number 2 is this red patch on the left top side of the cheek. It's itchy, been for 6 months, gone to the polyclinic, got prescriptions, medication, but it doesn't help. Is that cancer?
Well, so again, any red patches that appear on any sun-exposed areas should be properly evaluated. I'm sure that the polyclinic doctor has done a detailed examination for you, and if the polyclinic doctor has prescribed the creams that he or she has given, which includes topical steroids and moisturizers, then it suggests that you were not treated for an underlying skin cancer, probably for an inflammatory skin condition instead, such as eczema or psoriasis. But having said that, if it's not responding, then you should actually tell your doctor that you're not getting better, and he or she may refer you on to see a specialist subsequently.
Yeah, so when it persisted, then you should go back to see the doctor. The other question is that, if a blister has turned dark, is it a sign of cancer?
So generally, blisters are not common signs of skin cancer, and there are several reasons why someone can develop blisters, which includes autoimmune conditions, insect bite reactions, even medications itself can cause blisters. So if a blister can turn dark, it may not be a sign of skin cancer, but you should see a doctor because it may still suggest that you need treatment for it.
So a lot of time the medication actually has steroids in it. How long can should the person use the steroids on the screen, on the skin?
You mean topical steroids? So how long
Yes,
you can use the topical steroids depends on the skin condition itself. It depends on how strong the strength of the topical steroids are, and it depends how long the patient actually requires topical steroids. So it's difficult to give a gauge as to how long a patient can use the steroids for. It really depends on all the above factors, and we do need to tailor the treatment approach to each and every patient individually. It can range from weeks to months.
So people with eczema, for example, and some of them are born with eczema, very serious eczema and prolonged eczema, and multiple, places on the body with eczema, do they actually now become more susceptible to skin cancer because of all the steroids, all the treatments and things like that?
So eczema per se is not a known risk factor for skin cancer, but prolonged and chronic inflammation can increase the risk of squamous cell carcinomas, especially with long-term ulcerations, as well as ulcers, yes. So, but not eczema specifically.
So care for people with eczema, and people with eczema, especially with or without flare-ups, do they actually should, wear more sun protection or avoid the sun?
Well, for patients with eczema, there's no indication for them to wear more sun protection or avoid the sun. I would say that they should still adhere to regular sun protection practices, such as the list of things that Dr. Mok has alluded to.
Okay, there's a question here is that, I think he meant tropical white patches on the face is getting more as it ages. The tropical white patches on the face, is that something we need to worry about?
So I think the question is referring to the typical white patches that appear as we age, may or may not be related to a facial location. So again, there are many, many different causes for white patches to appear. One of the most common reasons for white patches to appear would be over the sun-exposed areas, especially on the arms and the limbs. There's a very long name called idiopathic guttate hypomelanosis, or IGH, whereby you see small little white dots that appear on the shins as well as the forearms especially. So these are actually related to sun exposure. It may or may not be reversed. Most of the time, we tend to ask the patients to leave alone and to adopt sun protection practices.
Okay, this is a very specific question for Dr. Young. For case 3, 4, and 6, Why are the growth at odd places come on eye, nose, one side of the face? Is there overly exposure to some specific area, to UVA, UVB? They have radiation. That's like a spot test now on the slides that you have done. We couldn't
Yeah,
hear
it's
you.
like testing my memory. So if I can recall, questions 3, 4, and 6 allude to skin cancers that arise on the skin. So if I can recall, the question 3 would be the squamous cell carcinoma, 4 would be the basal cell carcinoma, question 6 was the melanoma. So it's a good question. Sometimes our patients also ask us why these tend to arise on areas that may or may not be exposed to the sun. And the reason is, I guess, straightforward, yes, and yet not so straightforward. So firstly, there are many different reasons or risk factors that can increase our risk of skin cancer. And UV radiation is just one of them. So if you have seen, I think quite a few of us have alluded to the risk factors for skin cancer. There are modifiable and non-modifiable risk factors. So it may not be 100% due to sun exposure. And if you look at the melanoma that arise on the bottom of the leg or the sole, that may not be actually be directly resulting from UV exposure.
Vitamin D, and then also about sunscreen peels, right? And the question come back again, and this is something very interesting, is this, would it counterproductive? How much enough is enough for both of them? Because would that actually counterproductive as it is? This is I think this has a question.
Yes, people
we
tend
have
to have
three
that
questions.
question. Yeah, people tend to have that question because if you were to think logically speaking, if you're putting a lot of sunscreen and your skin is an organ that helps to generate vitamin D, and if you protect from the sun, you're not going to get much vitamin D. Okay, so I can understand why this question would tend to arise a lot more. And in fact, when studies have been done on this, it was a very tough kind of way of trying to group all these studies together to see what the final result's going to be. Really because people have different lifestyle choices, different lifestyle practices in terms of how much sun they're getting out. And more importantly, everyone is different in terms of their skin color. So to give an example, someone who is lighter skin tones, for which actually we do have a way of medically grading your skin fairness using the Fitzpatrick skin type. Okay, so it's graded based on if 1 or 2 is very, very fair, usually Caucasian skin. For Asian skin, it's probably about 3 or 4, or even 5, 6 sometimes. So what it goes to show is that for people who have different skin types and so on, they need and require different amount of sun exposure before they can generate vitamin D. So to put all of it together, if you're having a mixed bag of like individuals, different practices, and how to analyze whether or not is sun, are you getting enough sun, all this, it will be hard to group all these data together, which is why I explained earlier on in my slides that the weight of evidence based on what we have seen, both from all these studies, is that having sunscreen or vitamin D deficiency from sunscreen use is low.
Okay. So and if I may humbly summarize it in a way, is this: vitamin D is meant for better absorptions of calcium in the body. So it's for one particular use, right? And most of the people, they don't have to pay money for it, because if they go under the sun, they will get it free, right? But if for some reasons they are all cover up and they have used very thick sunscreen, they are unlikely getting any of those. That's why they have to pay money to actually absorb them. Correct? So that's number one. So in the event that the person use sunscreen and have vitamin D, that's fine. But what if they decided that applying sunscreen, like Alam has said, I don't like it, feels uncomfortable. I've decided that I'm going to have the pill for sun protection because I do go out, for my exercise or walk or whatsoever. Then I'm already on vitamin D, and then now I decided to have the sunscreen pill. Then how much is then become counterproductive to each other?
Yeah, so you must bear in mind that the sunscreen pills in a way works on antioxidative effects, okay? Meaning that they accept that some sun damage has been received onto the skin and the pill is trying to repair some of this defect. So in a way, it's kind of like sort of treating what has already been inflicted on the skin. And we are really going one step ahead of that by saying that we should want to prevent sun from actually reaching too much amounts onto your skin itself, because that's actually the best protection, rather than trying to remedy what has already occurred on the skin surface, which is the use of the oral sunblock in that respect.
So if somebody, for example, has to work under the sun and would have worn protection care, but they want to actually not age so fast, they want to protect their skin further. That's why they have the peel, so that, to protect all the free radicals whatsoever, so that the skin doesn't age as quickly. That's the whole point of having the peel, correct?
Yeah. So I would say more is better because
some
they do
ways.
work on different phases of how the UV radiation hits your skin and what kind of effects is it generating on your skin surface. So we want, of course, to start off with the prevention aspect, which is where the clothing, the physical sunscreen on your skin comes in, because they deflect and reflect UV radiation like a mirror. And then, of course, for which we must also bear in mind that the sunscreen is not 100% protective. So there's still a little bit of UV penetration that will reach your skin layer. And that is when the oral sunblock can help in trying to remedying some of the effects that it will cause on the skin surface. So in that case, it's a kind of a multi-pronged approach to, trying to have good skin health and sun protection.
So the sunblock pill, we call it nicotinamide. Does it mean that there's nicotine in it?
Fortunate that this term is so close to nicotine, but no, it isn't. It's actually a vitamin B3 derivative. So it can be considered as a dietary supplement, but it has no relation to nicotine.
Oh, wonderful. Okay. I was at one point worried about that. So that's great for people who don't smoke. Now, sun protection, sunscreen, right? There's so many varieties in the market, right? So the question comes, is there any difference between the cheaper ones and the more expensive ones? And, how should people choose?
I mean, there are many sunscreen formulations out in the market, and sometimes, because of the brand name and so on, they charge a premium for it as well. And of course, when it comes to value proposition, what you consider cheap or expensive is really individualized to the consumer himself. And I think it is why in this presentation itself, I have taken care not to push or really promote a certain brand of sunscreens, but to tell you that these are some of the factors that you have to look closely at the sunscreen to make your own decision. So for example, if a sunscreen fulfills what we think is a good sunscreen, meaning that you have an SPF level of 50 and above, you have a PA++ rating to guard against both UVA and UVB, by and large, this is a broad spectrum sunscreen. But the next step, of course, is to allow the consumer to decide for himself or herself whether or not you think the texture is suitable for you. This is something that you're happy to apply on your skin without causing any skin reactions, and that will be individualized to the consumer thereafter. And I think price point is, in a way, it's a secondary concern, but we're more concerned with the medical aspects of the sunscreen.
So for women, for example, on our face, we put a primer. It could have a UV, SPF, and then they put in a sunblock again, and then they put in their foundation, which are further like 3 layers of that. Does it mean that they have now 150 protection?
No, it's not a numerical addition in that way. Okay, and in fact, for just a tip, for example, if you want to apply sunscreens and so on together with other kinds of cosmetic products, by and large, the sunscreen should be I would say the last layer of it. So essentially, you realize it's a stacking phenomenon. You want to put a light moisturizer on your skin and so on. The sunscreen is layered right on top of it, really just because if it's, for example, a mineral sunscreen, it will act as an effective shield across the whole skin. Yeah, but of course, that being said, I can understand when some people use cosmetic products and so on, it can be a bit tough to try to get all of it on your face because, they could leave a residue, it might not work well with your foundation and so on. So in a way, it's really quite individualized to the consumer.
Yeah, it's quite challenging, I have to say. So though they have the perception, like when you're talking about, the gradient of the skin, etc. Now, it's been seen that when your skin is lighter, you have a higher risk of skin cancer. So this question number 21 says that shouldn't we get suntan and change the skin tone so we are less likely to have skin cancer? Is that a possibility at all?
Your skin tone, if you think about, so the skin tone is not like, oh, you have a darker skin, right? So the question lies is that when you are suntanning, you are artificially changing your skin tone, okay? But your natural skin tone can actually be seen from sun unexposed areas. And some of the areas to see would be actually, assuming you dress in a t-shirt and trousers sometimes, is the inside of your inner upper arm, okay, and the inner thighs. These will actually represent your, what we call true skin tone. Okay, so just because you go for suntan and so on, yeah, you may darken your skin, but that actually isn't really your true skin tone. And when you go for a sun tanning session and so on, while there are some good properties of ultraviolet rays or medical's ultraviolet therapy sometimes, for sun tanning booths and so on, you usually get the whole gamut of ultraviolet radiation, good or bad. So in a way, you're kind of just artificially changing your skin tone to make it a bit darker, but in return, you do inherit some of the damaging effects of UV radiation on your skin. And in a way, it's not considered productive because the melanin or melanocytes that's producing melanin for your skin is more inherently tied to your natural skin type.
Why is melanoma discovered later, leading to poorer outcome? I guess it's because it's been pretty serious. Yeah. So, question number 24. Why is melanoma discovered later, leading to a poorer outcome?
The tumor itself is symptomatic, and of course, where is it discovered at? So we do realize that in Asian patients, melanoma can be found in the digits or your fingers and soles of the feet, meaning acrolentigenous melanoma subtype, or compared to Caucasians and so on, where they are mostly found on the back or on the legs, where it's much easier to be seen. So as such, we do feel that it could be one that they occur on areas that is less sun exposed, and in so being, is less visible to people as well. So unless someone has a very good, healthy habit of checking their palms, their soles of the feet regularly, of course the incidence of detection could be a bit lower compared to other kinds of skin cancers, which tend to occur more commonly early on the face, which is very visible to everyone around you.
I see. Would you say that sunscreen for young children at primary age and people with senior age will be the same? They can use the same thing?
Well, so I mean, for all intents and purposes, the FDA also does recommend the use of sunscreen for kids 6 months and older. But of course, if the question arises like, hey, my skin is more sensitive, I'm not certain whether this would react to my skin. If my baby has very sensitive skin, or my elderly parents have very thin, sensitive skin, then of course mineral sunscreens are the way to go, for they are more inert and they're less irritative in nature. But sunscreen, by and large, in terms of the SPF level and the protection grade, I mean, the more is always better, whether you're in a young or older age group.
I see. And also that depending on the time they are exposed to the sun, and then we play soccer outside every day. My God, I mean, I live across the field, so I know. Quick question is this: how far away should they sit away from the window when they work? Especially in these days, a lot of people work hybrid. Is that should they wear sunscreen? How far away from the window, then they will probably be protected from the sun.
Well, I mean, so long as you are in the sun exposure, when there's light casting on you, definitely there will be UV radiation as well. UVB doesn't actually quite get through the windows, but UVA would be able to, which is why we would say it's best, well, of course, to just really sit away from the window as much as you can. But definitely you'll be expecting a bit of UV radiation through the window panes as well.
Okay, I'm not sure whether it's UV or UVB because can the UV be accumulated in the body then have reaction later?
Well, I mean, the correct thinking behind this is that the UV doesn't accumulate in your body, so you're not going to become a radioactive man when you're 80 years old. It doesn't quite work that way. But what happens is that the UV damage on the skin accumulates. So I think that's the proper wording or a proper angle of the question, that the UV damage of the skin accumulates, which also explains why people who are 80, 90 years old, the skin just looks a lot more wrinkly, sun damage, you get pigmentation and all that. And this is the accumulation of UV damage over the years, more so than they are accumulating radioactivity over the years.
I see. So yes, so start young and start looking after your skin at a young age. Start putting on sunscreen at a young age. Let's move on to the nails. So we're going to strike from one way to the other corner where we are talking to Dr. Puendran. There are a few questions on. I mean, I have to admit that the photographs that you show on your slides were quite gruesome, if I say. So nail cancer. Nail cancer spread to other skin parts and become other types of skin cancer, or it only happens to the skin? Or is there something called nail skin cancer and it's only restricted to the nails?
So nail cancers are essentially, majority of them are essentially skin cancers. So in a way, they are one and the same. But there are of course, there are different types of cancers that can affect the nail area, same as in the skin actually. So you treat them based on what the specific cancer type is. Can they spread to other parts of the body? Definitely. That's why they're called cancers. And that's why we need to treat them as based on the cancer type.
Okay. So nail cancer is part of skin cancer, or one
Yes.
type of skin cancer.
It basically, I'll put it as nail cancer actually is skin cancer occurring in the nails.
May I ask you to repeat this again, please?
Nail cancer, when the term nail cancer, what we're actually referring to is skin cancer occurring in the nails.
So okay. I hope that gives them a clearer picture of that. And so with so many people that are more savvy with technology, etc., and like what Alam has said, and all the today present has said is that majority of time when you start looking at something on the skin, you're looking at the size, the color, the texture, etc., etc. So this question came up: is there an app that they could take a photo and then you could determine whether something I should immediately get it checked, or is something that's normal, is okay? Is there something coming up like this?
I think that's a great question. I have to ask my colleagues whether there's something like that up. I guess the short answer is not that I know of at the moment. And the things that also, I mean, I hope I didn't scare people with the pictures that I showed, but there are more scary ones that we have, obviously, because we see patients with more advanced disease. And the thing is that patients with advanced disease, it's quite obvious that something is wrong. What we're trying to pick up are the early ones, and that's where honestly it does get confusing, and it is difficult even for us to pick up. So just imagine if you're looking at it physically, where you can also assess whether it's raised, whether a few other characteristics, whether there's dimpling, as what Dr. Yong mentioned. It's already difficult enough to assess physically. If you are just taking a picture of it, unless it's very obvious, I guess we miss certain other things that we do to assess, and our ability to make a diagnosis will then be, I would say, lowered. So I guess just pictures alone don't tell the whole, don't give you the whole, I mean, don't make it totally alone only.
I guess it's something like, these days where they try to talk about whether your body type is what kind of metabolic rate. They will ask a few questions, and then is it dimply? Does it itch? How does it feel? Etc. Etc. And there'll be narrative to it, and then send a photo. And the photo can be looked into it and then be contacted much later for diagnosis. I think as people start to use technology, and this is one of the areas that is probably worthwhile thinking about it, but I understand. Now, with a lot of these days, we are doing a lot of manicure, pedicure, with gel nails, with a lot of the UV lights to dry it and things like that. What would cause, or do you see a higher cases of people who regularly does those contacting nail cancer these days?
Okay, that was a question that I was scared of, because when people start talking about manicures and gels and everything, I have a little bit of a blank look, because not all of us for these things and really understand what's being done. So I may need to look across to see whether they can help me what exactly a gel manicure is. Do we see that as a cause for skin cancer in the nails? No. But I guess that's in the absence of understanding what exactly is done during these procedures. That's from me. Shouldn't be, right? I'm looking across to my my colleagues, and because
Dr. Young, let me ask this question to Dr. Young. So
Sorry.
I'm not sure if you have done your gel nails before, but doing the gel nails, as you know, they need the machine to actually dry it and things like that. And there are people who does this on a weekly basis. I can't, because my nails just cannot tolerate that. But there are people who do this very regularly. Is that a sign of concern?
Gel nails involve curing acrylates on the nail plate itself. It depends on the light source that's being used. A lot of the current salons, they actually use LED lamps, which do not pose a huge issue with regards to increase of skin cancer. But there have been some studies that have been published, And there have been some concerns also that use of certain lamps can increase the risk of skin cancers under the nails. So if you have read the recent article published by the Journal of American Academy of Dermatology, they actually recommend application of sunscreen around the nails when you go for your manicure. So that's something that you can do.
Okay. So that's that. Are there any symptoms chronic? Okay, sorry, this question comes a bit. Let me just give a little slight jump to this. This question was directed at Dr. Mock. I have sunscreen SPF 50 water-based formula free from paraben. What is paraben?
Preservative. It's a preservative within this. So it's meant to stabilize the formulation for you, such that your sunscreen doesn't expire that easily. You know, it helps to stabilize. So it's a preservative.
So paraben is a preservative. I see. Okay, thank you. And the pigmentation on the nails, sometimes it's there, sometimes it's not, and then it disappear. And the lines, are these something to cause for concern?
If they disappear, that's good. That's the bottom line. I guess what we're worried about are because pigmentation happens most commonly because we injure our nails, we run or whatever in our feet. So if they're there for a while and they go away, that's good. And that's actually some things you watch out for. Now, what we don't want is if it's there and it gets bigger, progresses, and then it starts involving the skin around the nails, what we call the nail folds, or even the nail itself starts getting destroyed or bleeding. So those are the things that we worry about. If they come and go, that's okay. That's probably due to an injury or something temporary that caused some injury to the nail. And actually, when we see patients also, that's what we use to assess. Because when we see a patient, sometimes, is it something that I need to biopsy straight away, or is it something that we should watch and see whether it goes away over some time? Because we don't want to rush in, and you can imagine the biopsy process is painful, and there is some downtime after a biopsy. We don't want to rush in and biopsy every single patient that comes to see us with pigmentation of the nails, because and that's sometimes a judgment call that we have to make.
Thank you, Dr. Mark, Dr. Young, Dr. Goon, and Dr. Puhendran. We are now going to come into a poll. Is that after the full presentation, the question asked to the audience is that, will you now start using a sunblock? After hearing the presentations and the Q&A questions. And while you're at it, we would like to once again thank our speakers, Dr. Mok Junren, Dr. Adeline Yong, Associate Professor Peter Goon, Dr. Mark Edward Puhendran, and of course our cancer survivor, Mr. Muhammad Alam, our partners, Singapore Cancer Society, 365 Cancer Prevention Society. And I'm just wondering if we have poll results from this last questions that we have. And before the session would end, there will also be a feedback form that we would ask you to please kindly scan the QR code and click the link in the chat box, to fill up the feedback form. Did we have yes, poll questions? Wow. We have a record. 87% of the people that attended today's talk think that they now put on a sunscreen. That's good news. That's good news to everyone. Yes, that's the whole purpose. You have meet your objective, doctors. We will start using sunscreen. I can see the thumbs up from the two doctors. Thank you very much, and thank you so much, doctors, for your time this morning. And again, for all the participants who have joined us, for the first timers, welcome, and we're great to see you. For those who are returning, we hope to see you again, and all of you. And please do scan the QR code that we're presenting shortly for the feedback form. And do keep a lookout for more cancer awareness activities coming this October and November. October and November is really the busy period with a lot of public forum happening. If you want to hear or see the slides again, please do check out the Facebook pages of Cancer 365 and also the NCIS website. And everyone, thank you so much for joining us this morning. And we apologize for all the technical faults and challenges we have. We'll do better the next time. And for more information and details, please check out the NCIS website. With this, everyone, have a lovely weekend. Thank you, doctors, and have a good weekend too. Thank you very much for your dedication. Thank you, everyone. Thank you.